Mr. Premier, Ministers, and ladies and gentlemen on the task force, I can't quite see your picture yet. Let me just, Premier, if I could, and to people who could be watching this, just make a few comments about where we are in the vaccination rollout now. In the task force mission to roll out an efficient vaccination program to the people of Ontario that is fair, so that the people who are eligible for that vaccine can make a decision as to whether or not they want to receive it based on the good knowledge that they have of it. Here is where we are at this moment. We have vaccinated in the province of Ontario more than 50,000 people who wanted to receive that vaccine. More than 50,000 people have been vaccinated using almost exclusively the Pfizer vaccine. Because of that, from the first 95,000 Pfizer vaccines that we received, we have less than 35,000 sitting in the freezers. We held on to many of those 35,000 because we wanted to ensure, as we said from the start, that we would have a second dose available when day 21 started rolling around, and we did not want to be caught out because we weren't sure of the supply. Well, ladies and gentlemen, we're using those doses right now to start today, because it is today that people in larger numbers are coming back for the second dose, and we're using those doses that we held back because we did not have any other. And I know we have a shipment coming in this week, probably tonight, tomorrow, but we don't have it to use today, and we're glad that we held some of those vaccines back. 50,000 plus vaccinated, and now people are coming back in numbers for their second dose. We've ramped up our flow-through at the vaccination sites in 19 different locations, and we are heading to that, and we are now doing 10,000 vaccinations a day plus. And so at that rate, the Pfizer vaccines that we still have in the deep freeze that we were holding back for the second dose just in case, we will exhaust those by the end of this weekend. We will be out of all the initial shipments of Pfizer by the end of this weekend. And we will use the shipment that is going to arrive, I'd like to say, either tonight or tomorrow, 47,000 doses of Pfizer, and we will use that as quickly as we possibly can on 10,000 vaccinations a day, and by end of next week, we will be out of that shipment also. We still do not know when the shipment that was predicted for next week of Pfizer vaccines will arrive. And so we will be out of the initial ones by the end of this weekend, and by end of next week, we will be out of the shipment that is going to arrive in this next several days here. We at the same time have launched and taken the challenge from the Premier to complete all the long-term care homes in the 4 regions of Toronto, Peel, York, Windsor, and Essex, and look after not only the healthcare workers that we have been trying to vaccinate during the past weeks here, but also using the Moderna arrival to be able to go into those long-term care homes and vaccinate the residents who are there. And they're the ones who have been most vulnerable, most fragile, and we have launched on doing that. In the 4 regions, we have 161 long-term care homes. We need a total of about 55,000 doses of Moderna or Moderna and Pfizer to do all of the people in there with their first shot. And I know the Premier has announced that he's challenged us to finish this by the 21st of January. We've taken that challenge. We've already launched on it, and we think we're going to finish it earlier than that. We're going to push to ensure that because we want to ensure that those vulnerable people, that is our first priority, are going to be protected as soon as we possibly can. And I give you the example of the Michael Garron Hospital. I'll go to visit them tomorrow very quickly, and they'll be putting the last dose in the arm of a person in one of those homes, and they will have completed 12 long-term care homes and 11 high-risk retirement homes that they have in their umbrella and try to help out. So we've launched on the long-term care, the care homes, and Premier, we're going to meet your challenge. At the same time, we've launched the operation in the north, and we're going to talk about this at the task force meeting here, working in conjunction with the leaders. We want to get into the north, those isolated communities, those places that are fragile, where perhaps the medical system is not as robust if something should occur as it is in the south part of Ontario. And we are going to start on Thursday and Friday of this week, going into some small long-term care facilities along the James Bay and vaccinate the residents and the care workers who work there. And at the same time on Thursday and Friday, we're going to commence in Sioux Lookout with the long-term care, several long-term care facilities there, smaller ones, yes, with the staff, but then also do the hospital staff, so that's a bigger figure of over 500,000. All of our Moderna vaccines, which we received in the afternoon of 30 December, and less than 24 hours later, we're vaccinating people in long-term care residences because we can move out there and do it. All of those long-term care residents and staff will utilize and require all of the Moderna vaccines that we got in that first shipment, some 55,000 of them, and we will give them their first needle. The next shipment of Moderna is not due to arrive till a week from now, and so we will keep that second shipment, minus about 10,000, which we'll take off and use to get into those isolated communities in the north. All of those vaccines will also be reserved for the residents in long-term care home for their second needle, because we don't have any more shipments of Moderna until further out, and we need to guarantee that we've got the second dose of Moderna available for them. We will start tomorrow moving Pfizer, and we want to do it carefully, obviously. We wanted to establish the protocols in this last several days, and we'll start using Pfizer, and any Pfizer vaccines that we have that are in excess to what we're doing to healthcare workers, we will move them to accelerate the process of the long-term care home challenge and completing it that, Mr. Premier, you have handed to us. And so with that, sir, I would stop and say your vaccination program is rolling out. We will be out of the first allocations by the end of this weekend. The shipment that arrives in the next day, we will be finished it by next Friday, and we still don't know when the next set of vaccinations will arrive in Ontario for us to use.
That's great. Thanks, General. Well, thank you so much, General. And as we heard this morning, folks, we're working around the clock to get these vaccines into people's arms. And matter of fact, as the General has said a few times, as we ramp up, and if you notice throughout this pandemic, it might take us a week, maybe a couple weeks to ramp up, but once we get the machine going in Ontario, we kick butt anywhere in the country in North America. No matter if it's the testing that we're leading North America or even the world in testing, no matter if it's a PPE or any other challenge we've had, once we put Team Ontario behind it, we become the leaders, and we will become the leaders in North America as this machine starts rolling out. And I want to thank everyone. I had an opportunity to talk to all the CEOs the other night, kind of gave them the old rah, 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 let's go. And the numbers since that conversation has jumped up drastically to the point that we are going to run out of the Pfizer vaccines this weekend. And we just pray to God, and I'm confident they will arrive this week, later in the week. But even that shipment, we will run out by next weekend. So as we start rolling down the highway per se, the frontline folks are going to get taken care of, but the number one priority is long-term care. It's always long-term care. We've put out a challenge. We said that we're looking for the 21st. Our target is the 18th. That would be great. But we will have every long-term care patient and worker that wants to get vaccinated by at the latest January 21st. And then we're going to move right across the province. The 4 areas that we're focusing on are the hot areas. Again, I'll repeat what the General said, but it's Toronto, Peel, York, Windsor-Essex. That's our focus. That's where the majority of the cases. And folks, once we get our hands around this long-term care and the healthcare workers, that's 80% of the challenge right now. We're going to continue moving forward. I have all the confidence in the world in our team. And I say our team, everyone from the hospitals, the PHUs, to our task force table, to the General, the ministers. I've seen this roll out before, and I've seen what happens. Once we start rolling, just move aside, because we're gonna lead North America once again. So thank you everyone for everything that you're doing, and I'll either pass it over back to the General or the Minister of Health.
Premier, thank you. If I could just make one more comment, which I was neglectful and didn't make at the start. As we move forward now through January into February, the allocations of vaccines arriving in Ontario are relatively small. In fact, they are small. And so as the number of people who await their second needle grows on a daily basis, our space to move beyond that is limited in the extreme. And next, obviously, in accordance with the direction of the government, your direction, Mr. Premier, we want to move to long-term care homes outside of the southern part of Ontario, and it's going to be extremely difficult to do that and any other part of the mission unless those allocations increase. Because the second dose, we're obviously going by the monograph that each vaccine is a 2-needle program. I had my shot at changing that, it didn't work, and so we're going to give the second dose, obviously, and that means the space left above that is much smaller, and our flexibility in January and up to late February, even in March, is restricted. We could use more doses, thousands more.
Okay, thank you.
Just a couple of questions, quick questions. Okay, let me get the mic all set up first of all.
Sure.
Thank you, Premier.
Yep.
I'm going to drop it right there.
No problem.
There has been some criticism, and that's actually backed up the fact that we're now the second lowest in the province of all the provinces in administering vaccines. Why is that?
Well, let me tell you something. We've vaccinated more people than any other province in the entire country, to be factual. Per capita, yes. Did we hit a couple bumps in the road? I'm always first to admit. When there's bumps in the road, we get through them. We've seen this throughout this whole pandemic. But I can promise the people of Ontario, we will make sure that every long-term care patient that wants it, and hopefully all of them want it, and every healthcare worker in long-term care is vaccinated at the latest of January 2021. And I think that's a real accomplishment. And I have all the confidence. Just stay tuned. We are going to run out of these vaccines by the weekend if we don't get this shipment in Thursday. Once we get this shipment in Thursday for Pfizer, we're going to run out of it again the following weekend. Folks, we're ramping up. We will be the leaders of Ontario, because in Ontario, we don't take second place to anyone. We've always been leaders. We're going to continue being leaders, and just look forward to getting more vaccines. That's what we need.
Thank you. And Quebec is expected to announce a set of really restrictive lockdowns, possibly including curfews and shutting down a lot of businesses. Your reaction to that, and can you expect that in Ontario, because the numbers are continuing at over 3,000?
Well, let's see where the numbers go. I always say everything's on the table, but let's see where the numbers go. I'll have a discussion over the next day or so with Premier Legault. I know we're having a discussion with all the premiers and the federal government on Thursday. Our message to the federal government, just keep these vaccines coming, because we are going to be running out of the Pfizer vaccines. We need more Moderna. That's focused on long-term care, but we will run out. And that's a perfect example of once our machine gets going, and it's going, and the hospitals start going, PHUs go, the paramedics go, everyone's going, watch out. There's no one that will be able to compete against us.